What if the material inside your mouth could affect not only your smile, but your long-term oral health, comfort, durability, and even the future of modern dentistry? In today's world of dental implants, one debate dominates cosmetic dentistry and implant dentistry. Zirconia implants versus titanium implants. One is marketed as the future of metal-free biological dentistry. The other is considered the gold standard with decades of clinical research. But which one should you trust? This deep dive uses modern dentistry, 3D dental animation, dental health research, and oral health science to explain the real differences between zirconia implants and titanium implants, including durability, aesthetics, safety, healing, long-term success, and why some dentists are moving towards ceramic implants. If you are considering a dental implant, full mouth restoration, all-on-4, all-on-6, or tooth replacement, this may be one of the most important videos you watch. And stay until the end, because the final comparison may completely change which implant you choose. In the United States, millions of people are now replacing missing teeth with dental implants instead of bridges or dentures. Modern implant dentistry has transformed cosmetic dentistry and dental restoration by allowing patients to restore chewing function, jawbone stability, smile aesthetics, confidence, long-term oral health. Today, procedures like all-on-4 and all-on-6 are more popular than ever. But there is one major question patients ask: should I choose titanium implants or zirconia implants? What are titanium implants? Titanium implants are small metal posts surgically inserted into the jawbone during a dental implant procedure. They act like artificial tooth roots and support dental crowns, bridges, full mouth restoration systems. Titanium implants have been used in dentistry for decades and remain the most researched implant system in modern dentistry. One reason titanium became the standard is because the material can fuse directly with bone through a process called osseointegration. This is why titanium implants have extremely high success rates in dental care. What are zirconia implants? Zirconia implants are made from zirconium dioxide, a strong ceramic material. Unlike titanium implants, zirconia dental implants are completely metal-free. This made zirconia implants especially popular in biological dentistry, holistic dentistry, cosmetic dentistry. Many holistic dentist clinics market zirconia dental implant systems as a cleaner, more aesthetic alternative to traditional metal implants. Because zirconia is naturally white, the implant can blend more naturally with gums and teeth. This became a major advantage in smile makeover and cosmetic dentistry cases. The aesthetic difference. One of the biggest reasons patients choose zirconia implants is appearance. Titanium implants are metallic gray. In patients with thin gums or gum recession, parts of the implant may sometimes become visible near the gum line. Zirconia implants solve this problem because ceramic implants are white. For front teeth, this can create a more natural appearance. This is why zirconia versus titanium discussions are especially important in cosmetic dentistry. Patients seeking the perfect smile makeover often prioritize aesthetics over everything else. Strength and durability. Now comes the part most advertisements don't explain. Titanium implants are incredibly durable. Titanium has slight flexibility, allowing it to absorb chewing pressure over time. This flexibility reduces fracture risk. Zirconia implants are extremely hard, but also more brittle. That means ceramic implants can crack under extreme stress more easily than titanium implants. This becomes especially important in full mouth restoration, all-on-4, heavy bite force patients. In implant dentistry, long-term durability matters more than short-term appearance. Why dentists still prefer titanium? Despite the growing popularity of zirconia implants, titanium implants remain the gold standard in dental implant systems. Why? Because they have decades of research behind them. Clinical studies on titanium implants include long-term bone stability, implant survival rates, chewing force resistance, complications over decades. Modern dentistry trusts titanium because the data is overwhelming. Many dentists believe titanium implants still offer the safest long-term solution for tooth replacement. Why zirconia implants are growing fast? At the same time, zirconia implants are becoming increasingly popular in America. Searches for zirconia implants, zirconia versus titanium, and ceramic dental implants continue rising every year. This growth is connected to holistic dentistry, biological dentist trends, cosmetic dentistry demand, metal-free health movements. Public figures like Dave Asprey have also increased awareness around biological dentistry and metal-free dentistry discussions. Some practitioners, including Dr. Dominic Nischwitz, promote zirconia dental implant systems heavily within biological dentistry communities. Biological dentistry and holistic dentistry. Biological dentistry focuses on the idea that oral health affects the entire body. Holistic dentistry clinics often emphasize metal-free materials, biocompatibility, oral health optimization, inflammation reduction. This is where zirconia implants became highly attractive. Many holistic dentist clinics believe ceramic implants may reduce inflammatory responses compared to metal implants. However, research on this topic is still evolving. Are zirconia implants better than titanium? This is the question everyone asks. The answer depends on the patient. For aesthetics, zirconia implants often win. For long-term durability, titanium implants usually win. For decades of scientific data, titanium implants dominate. For metal-free dentistry, zirconia implants dominate. This is why zirconia versus titanium dental implants remains one of the biggest debates in implant dentistry today. Bone integration and healing. Both titanium implants and zirconia implants can integrate successfully with jawbone, but titanium currently has more predictable long-term data. During a dental implant procedure, successful healing depends on bone density, gum health, oral hygiene, dental care, smoking status, medical conditions. This matters more than the material alone. Even the best implant can fail with poor oral health. The problem with online fear marketing. Many videos online exaggerate risks. Some claim, titanium implants are toxic. Root canal treatment causes chronic disease. Dental crowns are dangerous. Amalgam fillings poison the body. These claims spread rapidly online. But modern dentistry relies on evidence-based science. While some patients prefer metal-free alternatives, most titanium implants function safely for decades. It is important to separate research from fear-based marketing. Root canal treatment versus dental implants. Many patients compare root canal treatment with dental implant replacement. A root canal attempts to save the natural tooth. A dental implant replaces the tooth entirely. Whenever possible, many dentists prefer saving natural teeth first. However, severe infection or structural damage sometimes makes tooth replacement necessary. This is where dental implants become essential. Ceramic implants and the future. Ceramic implants may continue improving rapidly. New manufacturing systems like CAD/CAM dentistry allow more precise implant design and dental restoration customization. As ceramic implant technology evolves, zirconia dental implants may become even stronger and more predictable. Some experts believe the future of implant dentistry may involve hybrid systems combining titanium and zirconia advantages. Screw-retained crown technology. One major advancement in implant dentistry is the screw-retained crown. This system allows dentists to remove and repair restorations more easily compared to cemented crowns. Both zirconia implants and titanium implants can support screw-retained crown systems depending on design compatibility. This improves long-term maintenance and dental care flexibility. The real cost of dental implants. Dental implants are expensive in America. Patients often search, should I get an implant? Dental costs. Pros and cons of implants. The truth is that implant dentistry requires surgery, advanced imaging, cone beam CT scan technology, prosthetic customization, long healing periods. This is why full mouth restoration procedures like All-on-4 or All-on-6 can cost tens of thousands of dollars. Why oral health matters more than material. One of the biggest misconceptions is that implant material alone determines success. In reality, oral health matters more. Poor oral hygiene increases risk of infection, Asterisk gum disease. Asterisk implant failure. This applies to both zirconia implants and titanium implants. Healthy gums and proper dental care remain the foundation of implant success. Modern dentistry is changing fast. Modern dentistry today combines asterisk digital scanning, asterisk CAD/CAM dentistry, asterisk cone beam CT skin imaging, asterisk advanced dental restoration design, asterisk precision implant surgery. This allows better outcomes than ever before. Whether patients choose zirconia implants or titanium implants, modern implant dentistry is dramatically more advanced than it was even 15 years ago. The psychological side of smile restoration. Tooth loss affects more than chewing. It affects asterisk confidence, asterisk speech, asterisk appearance, asterisk mental health, asterisk social interaction. This is why smile makeover procedures have exploded across America. Patients are investing heavily in cosmetic dentistry and dental restoration because a healthy smile changes how people feel about themselves. So which implant should you choose? Choose zirconia implants if asterisk aesthetics are your top priority, asterisk you prefer metal-free dentistry, asterisk you want ceramic implants, asterisk you value holistic dentistry approaches. Choose titanium implants if asterisk you want maximum long-term research, asterisk durability matters most, asterisk you need complex full mouth restoration, asterisk you have heavy bite force. The best decision always depends on asterisk your oral health, asterisk jawbone condition, asterisk cosmetic goals, asterisk dentist experience. Final verdict. The zirconia versus titanium debate is not about good versus bad. It is about priorities. Titanium implants remain the most proven system in modern dentistry. But zirconia implants are rapidly growing because patients increasingly want asterisk aesthetics, asterisk metal-free options, asterisk holistic dentistry solutions. Both systems can transform smiles and restore confidence when used correctly. The future of implant dentistry will likely include both titanium implants and zirconia dental implant technology evolving side by side. Strong YouTube hook plus subscribe CTA USA audience. Before you decide on a dental implant, make sure you understand what's actually going inside your jaw for the next 20 years. Because one choice could affect asterisk your oral health, asterisk your smile, asterisk your dental costs, asterisk and the long-term success of your tooth replacement. Tooth subscribe now for more. Asterisk 3D dental animation. Asterisk modern dentistry explained. Asterisk oral health science. Asterisk cosmetic dentistry breakdowns. Asterisk dental implant comparisons. Asterisk root canal treatment education. Asterisk smile makeover transformations. Asterisk health education videos for America. New videos every week on zirconia implants, titanium implants, dental crowns, root canal, all on 4, dental restoration, and the future of implant dentistry.